project that we're working on at the moment is an exciting one that's going to be the first project to utilise samples from our newly established reproductive health biobank. So we're collecting placental samples from women at Northern Health and using those placentas to do experiments in the laboratory.
My project is about engaging surgical patients during the post-operative period with a specific focus on preventing and managing post-operative nausea and vomiting.
So this year we're running a number of studies that involve investigation and management of pleural effusions. A pleural effusion is a collection of fluid on the outside of the lung but on the inside of the chest wall, and we've got some images here on ultrasound, which is one of the ways that we evaluate pleural effusions.
My main project is looking at heart injury and heart attacks after major orthopaedic surgery. So hip fractures especially are relatively common in the elderly.
Research shows that engaged patients have a better understanding of their own care, therefore they're more likely to be adherent to their medication and their treatment, they're more likely to be involved in shared decision making with their healthcare team, which can improve care coordination and make the patient's journey safer.
Problems affecting the lining of the chest wall or the lung cavity sort of affects at least 8,000 Australians a year. And it's an extremely common problem. We do a few hundred procedures a year.
So the small research grant from the Northern Health Foundation is going to allow us to access equipment to ensure that we can perform reliable and robust investigations of pleural disease. In particular, we're really excited to be able to accurately measure diaphragm function in patients with pleural effusion.
The research grant has been vital for this research project. Firstly, if we can understand why some medications interfere with the measurement of placental DNA in the mother's blood, we might help reduce the number of failed prenatal screening tests that occur. Secondly, if we find that these blood thinning medications actually improve the cell health of the placenta, we can then move forward with other studies to test their ability to prevent pregnancy complications, such as preeclampsia and fetal growth restriction.
Hopefully we'll be able to show that with a simple medication that we give before the operation and continue through, not only do patients do better whilst in hospital, but also that they don't have any future heart problems.
The Northern Health Foundation scholarship has allowed me to fully dedicate my time to my project. Additionally, it has given me access to valuable resources such as the facilities and staff expertise at Northern Health, which has not only made my research stronger, but it makes the project more clinically relevant.
Northern Health Foundation scholarship was crucial in helping us conduct this research. So not only did it help with practical things like heart monitors and specialised blood tests, but it also meant that I was able to dedicate large amounts of time to the project, as well as start sub-studies like our OCT imaging study.
These projects are aimed at improving the safety and reliability of the way we manage pleural effusions here at Northern Health. Unfortunately, we do see a lot of pleural disease, and often it presents fairly late. It can be associated with infection but also advanced cancer. So we think it's really important that we manage this problem well, and these projects are going to help us improve the way we practice and also improve safety of our organisation and hopefully other respiratory services elsewhere.